Hello and welcome to our last video on chapter 26, where we are going to talk about shock and multiple organ dysfunction syndrome. So let's start off with shock. This is when our cardiovascular system fails to perfuse our tissues adequately. It leads to impaired cellular metabolism. We've got impaired oxygen use and glucose use. So our body is really turning to anaerobic mechanisms in order to create energy for our body. And we have a variety of manifestations that depend on the type of shock that we have, but it can include feeling weak, cold, hot, nauseated, dizzy, confused, afraid, thirsty, or short of breath. We can also have hypotension, tachycardia, and increased respiratory rate. Now, if shock progresses, it can lead into organ failure and death unless the compensatory mechanisms reverse the process. So in order to treat this before it progresses to that level, we want to find out what the underlying cause is and correct it. We also want to manage and improve tissue perfusion and give general support to the body so we can add IV fluids to expand our intravascular volume and use vasopressors, supplemental oxygen, and control glucose levels. So let's get into the details here of the specific types of shock. First, we have cardiogenic, which is when we have decreased cardiac output and have some tissue hypoxia while we have adequate intravascular volume. These tend to follow heart attacks, but it may also follow left heart failure, dysrhythmias, and valvular dysfunctions or pericardial infections or cardiac tamponade. And we'll get into a bit more detail on the next slide about that one, but let's talk about hypovolemic shock next, and that's when we have an insufficient intravascular fluid volume, which could be due to a loss of whole blood, such as if we're hemorrhaging, if we lose plasma due to burns, or maybe we are losing some of our interstitial fluid through sweating or diabetes or vomiting, diarrhea, or diuresis. Next, we have neurogenic shock, and this is when we have neural alterations of vascular smooth muscle tone. And this takes place when we have massive vasodilation due to an imbalance between our parasympathetic and sympathetic stimulation of our smooth muscles. We of course have anaphylactic shock as well, which we've already talked a little bit about, and this is going to involve our immunological processes due to a widespread hypersensitivity. And lastly, we have septic shock, which is going to be due to an infection that can progress from bacteremia to sepsis to what we have here, septic shock, and finally it can move into multiple organ dysfunction syndrome. So now let's take a look at some of the schematics that your book has put together. Starting with cardiogenic shock, we said that this was due to a decrease in cardiac output due to something such as a heart attack. And so your body starts to try and utilize some of the compensatory mechanisms in order to increase the cardiac output. So it is going to utilize our renin-angiotensin-aldosterone mechanism by utilizing renal responses as well as hypothalamic responses by telling the posterior pituitary to release ADH, which is going to either maintain or increase our blood volume. When we have signals from our adrenal gland, specifically the medulla, we are going to see that it will release catecholamine, so epinephrine and some norepinephrine, that is going to cause vasoconstriction and increase the contractility and our heart rate. Now, with both of these mechanisms in place, and we're having this increasing preload volume, stroke volume, and heart rate, we are going to see that that fluid will back up and cause systemic and pulmonary edema, which can lead to dyspnea. And also, it's increasing the heart's demands, right? So we're going to increase the myocardial oxygen requirements, which then leads to further decrease within the cardiac output and the ejection fraction. That then decreases our tissue perfusion, leading to ischemia, and that impairs our cellular metabolism, which then is going to cause myocardial dysfunction. So these patients will start to experience, like we said, dyspnea, tachypnea, systemic venous and pulmonary edema that we mentioned, our dusky skin color and marked hypotension, and oliguria. And because it is so difficult to combat these demands that no longer are allowing the heart to pump an adequate amount of blood, we get shock and impaired metabolism that is unresponsive to treatment, and so we have a high mortality rate here. Next is hypovolemic shock, and as we said before, this is due to a loss of whole blood, plasma, or interstitial fluid, essentially some type of decrease in intravascular volume, and this has to be decreased by about 15% in order to have hypovolemic shock take place. So due to that volume loss, we get a decrease in cardiac output. So again, we can see our compensatory mechanisms in this like orangey color. And so what we're going to see is that our adrenal gland is going to release catecholamines that is going to increase our systemic vascular resistance. Also, it's going to increase our heart rate and contractility, and this is going to help to increase our cardiac output, what our goal is. Other changes take place too, like we are going to see that the liver and spleen are both going to discharge blood volume by taking their stored red blood cells and plasma and putting it into our circulatory system. We'll also see that from the kidney, renin will be secreted, which then is going to stimulate aldosterone release, which we know is going to reabsorb our sodium, which then reabsorbs our water. And ADH is going to do the same. It is going to be our hormone that is going to cause water retention. And then we'll also have a shift of our interstitial fluid into our vascular compartment, so back into our cardiovascular system. And all of that is going to increase our blood volume, which then is going to help us to increase our cardiac output as well. But if we see that we keep losing the whole blood or the plasma or interstitial fluid, it's continuing, then we are going to continue to have a decrease in cardiac output. The compensatory mechanisms are not going to be enough to keep that cardiac output up. That then is going to result in a decreased tissue perfusion, which is also due to a decrease in the systemic and pulmonic pressures now, and that then can lead to impaired cellular metabolism. Now, this end stage is very similar to our cardiogenic shock that we just talked about, but the differences between them is going to be based on the fluid volume that our patient has and the cardiac muscle health. And some of the other clinical manifestations that we'll see with this is that they have poor skin turgor, thirst, oliguria, low systemic and pulmonary preloads, rapid heart rate, a thready pulse, which means that it's weak or it's difficult to feel, and there can also be mental status deterioration. And so what you want to do as far as treatment is to have rapid fluid replacement with crystalloids and blood products. And if it continues and does not get better, then it can lead into systemic inflammation and multiple organ dysfunction. Next up is neurogenic shock, which we've discussed before. This is also called vasogenic shock. And as we said before, this is due to a widespread and massive vasodilation due to an imbalance here in this nervous stimulation. So essentially, we are stimulating parasympathetic mechanisms and inhibiting sympathetic stimulation. And this could be due to some type of trauma to the spinal cord or medulla, remember, above the level of T6. And that causes an interruption in the supply of oxygen or glucose to the medulla. And we are then interrupting the sympathetic activity. So we start to lose the vascular tone that our sympathetic nervous system is set up to control. That leads to something called a relative hypovolemia, meaning that our blood volume hasn't changed, but our systemic vascular resistance has drastically decreased. And that is going to then cause the pressure within our vessels to fall and lead to inadequate cardiac output. So we're not able to then drive our nutrients through the capillary membranes and allow tissue perfusion to take place, which then leads to impaired cellular metabolism. Another symptom is that they can have bradycardia, which also further decreases the cardiac output and exacerbates the situation. So treatment for this is careful use of fluids and vasopressors until the blood pressure is able to stabilize. Next up is anaphylactic shock, which is a hypersensitivity type 1 reaction known as anaphylaxis. And it starts out by us having an antigen or allergen, and this could be anything from a bee sting to being allergic to shellfish or peanuts, tree nuts, latex, and certain medications such as penicillin. And so when we come into contact with that foreign invader that triggers this vigorous humoral immune response, we are going to get lots of IgE produced within our body in which the antigen is going to bind to, and that is then going to trigger an immune and inflammatory response that is mediated through our complement system, histamine being secreted by those mast cells, our kinins, and prostaglandins. So that being secreted is going to lead to vasodilation and vascular permeability. And we also get a constriction of extravascular smooth muscles. So we get bronchoconstriction, which makes it difficult to breathe, laryngospasms, and gastrointestinal cramps. And we can have other clinical manifestations as well, such as anxiety, dizziness, pruritus with hives, swollen lips, tongue, and impaired mentation, which is a term that we use for a wide range of conditions that are going to affect our mood, thinking, and behavior. So going back to when we have vasodilation and this increased capillary permeability, then that is going to lead to a relative hypovolemia, which then decreases our cardiac output and our tissue perfusion, and ends with impaired cellular metabolism. So the best way to treat this is to first remove the antigen if it's possible, and then to give an intramuscular injection of epinephrine, which can cause vasoconstriction and also reverse the airway constriction that we have. We also want to give fluids intravenously so that we can reverse this hypovolemia, and also give our antihistamines and corticosteroids so we can reverse the inflammatory process that took place. Last type of shock is going to be our septic shock. And as we said before, this is due to an infection that then progresses from a bacteremia to sepsis to septic shock, and hopefully not, but it can progress into multiple organ dysfunction syndrome. So unfortunately, it is associated with high morbidity and mortality, and the initial infection can actually be from bacteria, fungi, or viruses, but we tend to always discuss bacteria. And so some of the infections that could cause this to take place are pulmonary, intra-abdominal, and urinary tract infections. We can also see this taking place due to surgical wounds and indwelling arterial and central venous catheters that can have some gram-positive or gram-negative bacteria on it that makes its way into the blood. So let's get started on talking about the schematic over here. As we start off with our organisms, we could see that our gram-positive organisms are going to secrete exotoxins, which could be things such as lipotocaic acids or peptidoglycans, whereas our gram-negative organisms are going to secrete endotoxins, something like LPS. And what that does is it triggers the receptors on macrophages. So if it's an exotoxin, it triggers the toll-like receptor 2, and if it's an endotoxin, it triggers the toll-like receptor 4. And these macrophages are then going to release inflammatory mediators. So we can see them listed here: IL-1, tumor necrosis factor alpha, and nitric oxide. And we can also see a release of secondary mediators after this as well. That would include things like cytokines, our complement proteins, and prostaglandins, which then is going to cause a systemic inflammation. And this leads to a clinical presentation known as SIRS, S-I-R-S, and that stands for Systemic Inflammatory Response Syndrome. And it's characterized by the things we see listed over here: having a fever, tachycardia, tachypnea, and leukocytosis, which, if you remember, is an elevated number of white blood cells. That, along with the bacteremia that's taking place, is what leads to sepsis. Now, when we had that nitric oxide released, it caused a vasodilation to take place. And when we have vasodilation takes place, that means we have less blood volume going to our tissues, so we can have a tissue hyperperfusion, which is also known as warm shock. So warm shock is taking place earlier on in this condition. So we can try and compensate for the changes taking place to try to get back to homeostasis. And so we do see a little bit of an increase in our cardiac output because of the tachycardia. But over time, we start to build an unresponsiveness to or have a depletion within the vasoactive factors, such as vasopressin within our body, and that can lead to the hypotension that we see and also the tissue hypoperfusion. As this progresses, we are going to see that there is depressed myocardial contractility because of our complement system and the interleukins that were secreted, and we have worsening tissue hypoperfusion, which is known as cold shock. And notice that this is later in the shock progression and is uncompensated and is coupled with decreased cardiac output. And so now we have all this release of anti-inflammatory mediators, and we also have an impairment of the immune cell function. And this immune suppression is called CARS, the compensatory anti-inflammatory syndrome. And eventually this shock is going to lead to multiple organ dysfunction. Now let's talk about what that actually is. It's when we have progressive dysfunction of two or more organ systems that results from an uncontrolled inflammatory response to illness or injury. Causes most commonly will be sepsis or septic shock, and others are going to be severe trauma, burns, major surgery, blood transfusion, renal or liver failure, or pancreatitis. Some of the manifestations that we could see with this are fever, tachycardia, dyspnea, altered mental status, hyperdynamic or hypermetabolic stages, or acute respiratory distress syndrome. And as the syndrome continues, we see manifestations of all of these organ systems that are affected.